Today we're going to talk a little bit about autoimmune conditions as it relates to the thyroid gland. Chief among those is going to be Hashimoto's. Hashimoto's is characterized by both hyper and hypothyroid symptoms. People are sometimes lethargic at times and can be also agitated and irritable at times because it depends on the overall phase of where the individual is being affected. Ultimately, with Hashimoto's and any autoimmune condition, the thyroid gland over time gets destroyed and they find themselves in a hypothyroid state. So the real question is, what causes Hashimoto's? What causes the autoimmune reaction? There are a host of factors we identified many times associated with Hashimoto's. Viruses can do it because viruses in the body, like Epstein-Barr, which is a chronic virus that many people have, can find its way to the thyroid, and in the immune system's ability to try and protect you and handle the virus, it actually starts to program against your own thyroid tissue. So viruses, be it herpes virus type 6 or Epstein-Barr virus, which I mentioned, can certainly do that. Heavy metals. Heavy metals are all over our environment. Lead is still the highest, but mercury is very toxic to the body, and of course many people have mercury fillings that are very close to the thyroid and get into the circulation. And mercury specifically likes to bind to the receptor sites, and again, in an effort to try and detoxify or remove this irritant, the body begins to get confused from its immune system standpoint and starts attacking the problems in terms of the thyroid tissue itself. And so heavy metals are another mitigating factor. But probably one of the largest ones has to do with digestive issues. When individuals have leaky gut, which basically is also called increased intestinal permeability, they start developing a lot of food allergies and a lot of food sensitivities. And several of these food sensitivities have been directly linked to Hashimoto's, namely wheat. Wheat has a protein in it that actually mimics the thyroid tissues in terms of its overall structure and appearance. And so when the body starts attacking wheat as an allergen or a sensitivity, it also then will begin to start attacking your own thyroid tissue. So those are the mitigating factors we see a lot of times with autoimmune. The key is to try and get to the causality of what's causing the autoimmune reaction, not just to try and suppress the thyroid or just to put you on thyroid hormone until eventually your thyroid gland is burnt out by this disease. We also can give you things to protect your thyroid during the process when we're working on this. Selenium, for example, is a very important mineral to protect your thyroid gland during these autoimmune or hyperthyroid type situations that begin to occur. So that's a little bit of a look at the autoimmune issues of thyroid.